Hi, good evening, everyone, and welcome to the Avni in March webinar. So, a quick run through the agenda today. For those who are not, who've not seen Avni before, we'll do a very quick 5-minute introduction for Avni. After that, we'll talk about the new features that we added in March, and we'll talk about what's coming up in April. There'll be a brief demo where we'll show you what we've been up to in March. And right after that, we will go to the more interesting parts where projects will provide updates on what they've been up to. And we have two projects that are in today that they would like to share their stories about. So without much ado, let's start. A brief about Avni. Avni is an application that can be used for field work. If you look at what it can do, there is an Android app which is used by field workers, which is completely offline and can be used for collecting data. It also gives them insights to that say what should be done. It gives reminders to do things. And it also has some smart logic which you can use to nudge them to do the right things at the right time. There is a corresponding web-based application that people can use, and Avni itself is a platform, which means it can be customized and suited according to every field organization's needs. There is obviously an admin application where you put control and decide how your app should exactly look like, what kind of people should see your app, what they should be doing with it. And this is mainly meant for field workers to be using as their work aid. Avni is offline. It helps with case modeling. It has native support for household and members. So initially we started off this as something that can be used in the clinical domain or in healthcare, but eventually we moved out from healthcare to several different scenarios. And if you look at how it is used, it's primarily used in health even today. But you would also see things like social security. There's Waterbodies rejuvenation, which shows up as very small thing over here, but it's actually pretty huge in terms of usage. There is a shelter for homeless, which also shows up very small here, but it's actually pretty huge. If you look at the broad ideas of where it can be used, one important use case would be case management, where you have somebody or something that you track over time. This could be a person, this could be a water body, a building, anything that can be tracked over time. And surveys, which you might have one-off surveys that you keep going running for several times, and you would want to either follow up later with it or not. And it does provide help with both kind of scenarios. There's also cohort-based research studies. So last month, actually, there were two organizations which finished their studies and published their reports. And part of their data collection, not all of it, happened on Avni. It's open source, free and open source in the sense that people can start using Avni on their own if they want to. But Samanvay also provides a SaaS kind of a model where somebody can sign up, create an organization, start designing them, and use it in their field. So essentially, it starts with building your own MIS. There is an app builder which can be used to build an MIS. There are several extension points that can be used to extend them for your use cases. You can collect data either through the Android app or on the browser, which are kind of equivalent in terms of collecting data. And for the field users, it provides a lot more insights. There are dashboards that you can create for your field users that is customized for your workflow. There are beneficiary visit planning things that you can customize. And there's a lot of other logic which are native to forms and collecting data that's available on. The data is hosted on the Avni cloud server. which is what happens if you use the SaaS solution. If not, you could have your own implementation where you'd be collecting the data. Avni, the SaaS solution, provides analytics. So there are reports that you can create and run. And it does have APIs in case it needs to integrate with external systems, which some of the projects have been doing. In terms of reach and impact, it's been about slightly more than 30 projects, slightly more than 1 million beneficiaries, and about 3,000 people using the system. The new features that we started in March. So one of the things that we have is something called grouped form elements, and there will be a demo that will come soon. But some things that we've seen mostly when doing use cases is that there are fields that are common. For example, there's a field that you would want to collect that says how many people did you distribute something to, and you want the answer by gender or by age group. These are very, very common use cases, and we did not have native support for them in Avni, although there were other ways we could achieve it. As part of the March release, we are providing native support for grouped form elements, which is a relatively smaller feature, but the bigger feature that is probably going to be released soon by in a couple of days is something called Granular Sync. So as we grow in our in the whole community service kind of a model, right? We start discovering a lot of new things. Like when we started off with health, the idea was that every person will be assigned a catchment, which is like a geographical area where they could work. Whereas as we keep moving along the different styles in which these things happen, field work happens, we notice that it need not necessarily be geography specific. Some use cases we came across recently is in the field of education. We were working with an organization called Lend a Hand India, and there it's not geography specific at all. It's like there are a bunch of students who could be anywhere in the country, but they are all part of a particular program, and the worker in this case, who's a volunteer, is actually trying to serve this disparate group of individuals who are united in the fact that they want to work within a certain program. So there were also other use cases where similar kind of things happen. In some scenarios, these students are being assigned individually, not necessarily students in this case, but you could have people or beneficiaries being assigned to a certain field worker who would then take their case and move it forward. These are cases that we've seen in several other organizations, and the Granular Sync primary motive is to fix that. With this, I'll hand it over to Vinod to give a better overview of, or actually see this in action. Over to you, Vinod.
Yeah, thanks, Vinay. Let me share my screen. Okay, so as Vinay has already given a brief introduction about the features, so let's see them in action. So we'll go one by one. So the first is about the group form element. So first we'll see how we can basically use a group form element, and then we'll see how it looks while doing the data entry. So I have two subject types, one for each of the feature. The first one is the village vaccination reporting. So here basically we are collecting the data for a village. We are collecting the total population by gender and also how many are vaccinated. That is also by the gender. So the registration form looks something like this. There are like details and vaccination details. Two groups are there. And if you see there is a question group form element, which is the village population. And there are children form element of this village population, which are male, female, and total. So there is a rule which is on the total. It basically sums up the value of male and female. Similarly, we have for the vaccination detail, we have the similar kind of thing. There is a question group form element, and then we have the same children for it. So if you want to add any of the question group form element, it is very similar to adding any other concept. So like you can create a group. So in this case, I've created a group, and you can create a new concept here. So it's just that we have to choose the question group in the data type. And as soon as you hit the save, you see that there is a child which gets added, and I can basically add the more children to it. So so in our case, I have added it by the gender, but it can be anything by age group uh, or whatever is the use case. So for now, we'll go with this form. I have already synced this form, and whenever I basically register any of the village and the data for any of the village, so I'll do it for uh, this thing. So here it asks me so there is a grid view that you see that the same questions are grouped together. So it's easier to add the data and also easy to basically see this data. So let me add some data to this. And similarly for the vaccination given. Okay, so and this is how it displays in the recommendation screen. So yeah, so basically this is all about it, a new data type that can be used for like whenever you want to group your question by the gender, by the age group, or anything like that. So regarding the next feature, which is about the granular sync. So if you are a regular user of Avni, you might know that till now Avni uses the location to sync the subject type and its children. But with this release, now what we have given is for in each of the subject type, uh, under advanced settings, there are different sync settings that can be configured for a subject type. So this determines how this subject will get synced to the user. So sync by location is the default one. So like you create the catchment and assign it to the user. So only whatever subjects are registered in that location will get synced to that user. Then there is a sync by direct assignment. So this is what Vinay already described. Like whenever you want, whenever there is a student subject type, and you want to basically assign bunch of student to the user, then you can choose this strategy. And then there are two other things, which is the sync registration concept 1 and concept 2. So beside this, you can also use the form, the concepts in the form to sync the data. So the values of that concept can then be assigned to the user, and then only the subjects having that value will get synced to the user's device. So in our work order use case, we have basically we are doing the sync by location, and also we are doing the sync by concept 1. So here I have here we have chosen the registration year as the concept 1. So what happens is, whatever the value of registration year I'll assign to the user, only that subject will get synced to my device. Okay, so if we let's have a quick look at in the registration form also. So there is nothing much, like we just have the default fields, and then there is this registration year text field which is added, which we are using for syncing our data, right? And if we see the data entry app, so let's see our current work orders. Okay, I've created a bunch of work orders here. So there is a work order which was registered in 2019. Then there is a work order which was registered in 2020, and there is a work order which was registered in 2022. So these are the registration year values for each of the work order. So what we want is, we want to only have the latest year work order for any of the user. So let's see how to do that. So for that, I'll go to my admin users screen. So if you go to the user edit, so you see that there is a new settings that is added here, which is called sync settings. So here you can basically use which concept you want to sync and the value of the concept. So right now I have just given one value, but multiple values can be added. And if any of these values matches the subject's registration value, then it will get synced to the user's device. So that so this is how it will get synced for this user, which is user one demo. And one of the thing is, if we go back to our search page, one other thing you will see is all these are registered in the same location, right? So that is one thing. And but we will be only syncing one of it based on the sync attribute. Okay, so I've already done this sync. So if I search my work order, so you will see there is only one work order, which is 2022. So let's do one thing, like we will basically edit any one of the work order, and we'll also change the registration year for that. So if I go back to 2019 and I change its registered year to 2022, so this should get synced now to the device. Okay, and let's quickly sync this. Okay, so it is downloading the data. Okay, and if I go to search work order, then you see that this also gets added. So there is this search field which appears here, which says 2022. And like if I edit it again and move it back to 2019, then it will automatically get deleted. So that is all managed by the migrations. Let's sync it again. So basically what this means is now you are not like restricted to the location only. You can basically have more granular sync in the user's device. Like whatever you want to sync based on any of the form value, or based on like you want to like bunch couple of subjects and you want to sync it to the user's device, that all can be done in Avni now. So I think, yeah, so that's all about the two of the features. Uh, is there any question on any of the feature?
Yeah, Vinod, this is Pratishtha from JSS, if I'm audible.
Yeah, Pratishtha, you're audible.
So one of my question, I'm a bit unclear about this second, feature which you explained. So one of the option that you explained was the concept type, which was in this case the year of registration.
Yeah.
Can you give me an example of some other concept type so can I understand? So I mean, my understanding of this feature has become like it is more of sort of a syncing option by creating a filter. Like I really want to filter a specific thing, and so I'm filtering it out, and then I am syncing the device. Is that the right thing, right understanding, or I
Yeah,
have got something?
correct. You are absolutely correct. So basically we don't want to sync the entire data to the user's device. We just want to sync whatever is required for them. So in this case, I don't want to sync all the work orders, all the previous year's work order, because the user will be working on the current year's work order. So that's why in this case, I have chosen this registration year, and like I'll be in the value, I'll be adding the current year's value.
Okay, and so I mean, for better understanding of myself, it's like if there, suppose there is a course going on and there are 4 batches A, B, C, D, and only the C batch is given some assignment, and then we want only the C batch to sync it, so we can create the syncing filter of batch C and then get it synced. Is that, I mean, that's the correct thing, right?
Correct. Yeah, you can
Okay,
do that.
okay, now clear. Thank you.
Okay. Any other questions? Okay, so I think with that we can move to the next next section. So I'll hand it over to Vinay. Yeah, Vinay.
Sure. So I mean, one of the things with that sync feature is also that there's a bunch of other improvements also that have been happening within the app. So hopefully, if you find something good or bad, do inform us if you see some anything happening. Um, in terms of what's coming up in April and beyond. So one of the things that we've been working on is the whole reporting infrastructure revamp. We spoke about this last month as well. There's a bit of a lag in that getting complete. Hopefully we should get, at least from a product feature standpoint, that should get done by about next week. And then we'll slowly start migrating organizations to start using the new infrastructure. Basically, it's mostly around how to use resources better and how to get reports to be faster. That's the whole purpose of doing that. So that's like an ongoing activity from a product perspective, probably next month, next week. But from an implementation perspective, for each project to start reaping benefits, we need to actually push them or migrate reports for them to be able to reap the benefits of it. There's we did talk about the stock management app 2 months ago. It is live in one location and it is going live in another soon, but it does not have a management admin UI where you could add drugs and things like that. So this is something that we'll be picking up this month in April. There is I mean, you did see the granular sync. There are a few rough edges which need to be filtered, need to be fixed, which we will also be taking care during April. And there's something interesting with WhatsApp integration coming up. There's one organization who's asked to be doing this. This is a slightly longer term project in the sense that you would probably see this sometime 6 months down the line, I'm guessing. But if anybody has any ideas of how they would want to use WhatsApp within the system, please do inform us and we'll start building it so that it kind of caters to everybody's needs. That's about what's coming up in April and beyond. And with that, we move over to the next part of the discussion, which is essentially talking about the different implementations and how things are working. So I think Pratishtha is here. Pratishtha is from Swasthya Sahyog, would like to talk about their community health implementation at JSS. And let's actually hear from Pratishtha right away directly. So JSS has been working quite a lot within the village and the community health domain, and I am actually pretty eager to hear what has been happening and the recent updates within the projects. Over to you, Pratishtha.
Yeah, thank you, Vinay. And so I don't have anything to present for like screen sharing. I'll just be vocal here. So we are lucky to have Avni in our community program area since like past 2 years. So 2 years back we started with this development of the app and implementation. So a brief about JSS for the new joinees who are not aware. So JSS is Jan Swasthya Sahyog, and it's a tribal, it's an organization, non-government, which is working in the rural and tribal areas of Chhattisgarh to provide them with the quality primary health care. Not just healthcare, but it also works in some of the areas which are directly related to health, which we call as the determinants of health. For example, nutrition and livelihood and agriculture, animal health, things like that. So with time we had some, I mean, to cut the long story short, with time we had some vertical programs coming up as need of the time. So we have the main vertical programs that needed digitalization in some sense were the maternal and child health care program, the chronic disease care program, and the Fulvari program. So Fulvari is a creche system, rural creche system which JSS runs, and I'm sorry, and that is meant for children of 6 months to 3 years of age. I think we began initially with the MCH and Fulvari, and the third one which was taken up was the NCD. NCD is non-communicable disease. Currently, there are another thing which I would like to explain to give the context is the community health program of Jan Swasthya Sahyog is a three-tier structure. Three-tier means at the grassroots level we have some workers which are the like field level workers, village health workers, the trained birth attendants and others like them. Then we have the middle level workers at tier 2. So these are the I mean, if I talk in terms of program, so the maternal and child health workers, that they are the mid-level workers. The Fulvari supervisors in the Fulvari program, they are mid-level workers. And the senior health workers, again, they are the mid-level workers for almost all the diseases, specifically the non-communicable and the chronic diseases. And the apex of the three-tier system is our referral center, which is the 100-bedded hospital at Ganyari. It's a rural hospital with many of the tertiary care facilities as well. Now, how we enrolled Avni in these programs and how we are making use of it. So a lot many things are needed when you are running a community outreach program, that too in like a number of villages. So we are running it in 72 villages. Things that happen in all those programs are like data collection, then some field activities, then monitoring is needed, supervision is needed, then report generation has to be done to understand where the program is going, or to understand the resource requirement of the program. Before Avni, we all were having paper formats for most of the things. So you can understand, like in MCH program, for recording the new births, the deaths, maternal death, infant mortality, all those things we were documenting on paper. And if any data was to be pulled out, it was to be done manually. Now all our MCH supervisors, that is the MCH workers, they have smartphones with them and they are using Avni. They are able to do the home visits for mother and I mean their PNC visits, mother and children, and record the data then and there in Avni. And we can see that data like real time here in Ganyari. So that is something really useful for us. MCH program actually has three components. If I tell, it is the ANC, the antenatal component, the intranatal component, and the postnatal component. And all three of these components require some data capturing, require some activities, require monitoring, supervision, all those things. And Avni, through Avni, it has eased out their work as well. And it has really eased out our work in terms of pulling the data and understanding the patterns and the and where the things are going. Likewise, for the senior health workers, which are the mid-level cadres for the NCD care program, they are collecting the so they are able to once the diagnosis of a patient is made, so suppose the patient is of hypertension, and once the diagnosis is made by the doctor, they will then enroll the patient in the BP program. And after that, when they have to do the follow-up of these patients, because chronic diseases require long-term care and follow-up, so every month these patients are to be followed up, and it was really cumbersome doing on paper formats. So with Avni, they are open to they are able to schedule the follow-up visit for the next month, and then do the visit in Avni itself, and then again the visit of schedule the next visit. So in a way, they are able to kind of not forget what is to be asked when they are asked to the patient when they are doing the follow-up. So for example, if the patient is diabetic, you have to ask, did you have any hypoglycemic episode last time? You have to record their weight, and if it's a growing age child, I mean, young patient, you have to record the height as well, all those things. So sometimes you miss out on things because it's not possible to remember things every time. So Avni helps in that also, because there are checks at many points. There are things, fields which are made mandatory, so you can't actually move ahead in the form if you have not filled that particular field. So in that sense, things have improved a lot on field. Likewise for Fulvari program. So the good thing about it is we have this Avni in 3 programs, and these 3 programs have their own requirement, and then we have the customized forms for each of these 3 programs. Like if a child is enrolled in Fulvari program, the form will have things which are needed to be filled in the Fulvari care, in the activities that are to be done by the Fulvari supervisor. One of the things that was done very initially was we uploaded the whole of the population data of our encatchment area into Avni. So the next steps became really easy. So for example, if now today a new patient is diagnosed, suppose of sickle cell anemia, that person is already present in the population data, and the senior health worker just has to pick that person from the population data and enroll in the sickle care program, and that's it. Then they already have the first follow-up visit scheduled. I mean, they can schedule the first follow-up visit on their own, and rest is taken care by Avni. So this is the journey so far. At the Ganyari level, that is the referral level, it has eased out our work in the sense that we are, I mean, it's easy for us to get some ready reports at hand. Matlab, every time in the past we were to use manual calculations and find out things on our own. Now so many reports are there on different portals, like some reports are there on Jasper, and some Fulvari reports are there on I don't remember, I think Metabase. So it has eased our work, and others we can apply some filters by downloading the reports as well, and then we can make our own calculations out of it. And I think this is going to go like really far, because with time we have added requested the team to add new features based on our need. And currently also some new features are to be added, some new reports are to be added. I think the latest that we need is the individual dashboard. So as of now, we are able to see what is happening in the programs. I mean the program coordinators, but the worker who is filling the forms in the field, that is the MCH workers or the senior health workers, they are not able to understand. They are not able to have a bird's eye view of their work progress. So next thing is going to be the individual dashboard, so that they themselves are able to see how many of their beneficiaries are, like suppose how many of the patients are in disease control status, how many visits they could do, not do, and some like basic parameters they'll be able to see. Rest, I think it's like most of the places it is the same. Like for example, we need it in a local language, as many people don't understand English. I mean, most of the people don't understand English in the rural area, so it was easy for us to get the whole thing translated in Hindi. And it is really good to see the workers who were like some of them hardly literate, or I mean semi literate, they are able to use Avni so well. That is the ease of its simplicity and its usefulness. So yeah, I'm looking forward to the new features to be added to JSS community program, as well as the new features that keep coming every month. And that's all from my side. If any questions, I'm there to answer.
I did have one question, Pratishtha. This was useful.
Oh, yeah.
So one advantage, as you said, was when we started off, we actually uploaded the entire database of the catchment, so the demographic data of everyone. And essentially what happens is, like, if anybody is into multiple programs, this kind of like records it against one person. Now from a usage standpoint, right, so what this means is comorbidities are easily I mean, we can easily figure out comorbidities. And I'm not sure what kind of different things, interventions or processes, or something that we can do at the community level, if you know that there are certain kinds of comorbidities. Is that something that you've been actively thinking of or planning to do in the future?
Yeah, I mean, actually, there are things really affected by, I mean, if someone has comorbidities, for example, many of the patients who have hypertension today, there are chances that they will be diabetic in future if some of their disease factors are not under control, or if it is genetics involved, then of course there is no control on it. And it is vice versa also. So diabetics are also at risk of developing hypertension later. likewise. So the chances of the complication in any non-communicable disease increases with the increase in comorbidity or increase in the severity of risk factors. So for example, a diabetic will also have a risk of stroke, but a diabetic with hypertension will have even higher risk of getting a stroke. So as of now, actively though we have not thought in, I mean, specifically talking in terms of Avni, if there is some data to be recorded or some intervention to be planned, that is not really being thought of as of now, because the the single diseases are being worked upon even now, like erecting some like features which are not as of now very feasible to be used, not in the sense from like Avni's part, but how to do analysis from those things and make them more useful for the individual disease. We are in the process of thinking more about it, but certainly if we uh, I mean, in a little later stage, when these all things would be done and we would be moving towards more of a research oriented approach in the program, then we would really like to see a few things. I mean, right now I can give you one example. So there are different kind of medicines to be, I mean, which are available in the English system of medicine for the same disease. For example, if a person has hypertension, the person can be prescribed amlodipine, the person can be prescribed labetalol, the person can be prescribed propranolol and things like that. Likewise for diabetes. So we can see that if there was comorbidity, which drug combination could have been the best to prevent complication or prolong the quality of life of the patient. This is just like one thing which would be really required to see and do better for these patients. Or I will say, if we have that data, some idea we can make out of such an analysis, then we can apply those learnings to individual diseases to even prevent complications. But how that will all be, the uh, concrete plan is not there. I mean, it is not there even in some rough terms, but what is as of now fixed is ki certainly there has to be, I mean, we will be moving in that direction, but not right now. We are not in that stage. I mean, I hope I got your question and I explained it properly.
Yes, yes, this was very helpful,
Yeah.
Pratishtha. So I'll probably call you 1 year later and see if we can do something there.
No, I think we will be the ones calling you beforehand.
Yeah. Any other questions? Anybody else? Okay, we have one more speaker today, Amit Tarak from KPMG. So since 2019, we've been working with Amit and KPMG with several other partners such as the Maharashtra government and different stakeholders at different points in time. Amit has been like a constant since 2019. And the program that we are going to talk, that Amit is going to talk, is about desilting of water bodies. So this obviously desilting of water bodies is something that has to be undertaken regularly to maintain the health of the water body. And this is a program that's been running for quite a while. And over the different years, it has been expanding to different states, different water bodies and things like that. I think since in the past 3 years, we've probably kind of there have been about 400 different water bodies that they've targeted across the multiple states that include Maharashtra, Karnataka, and Rajasthan. Amit is here to talk about his journey and the journey of the program. So without much ado, Amit, over to you.
Hello, Vinay. Am I audible?
Yes, Amit, you're audible.
Hello. There is some network issue. Yeah. Thanks, Vinay, for the introduction. There might be a little bit of background noise. You guys, please bear with that. अब Vinay, am I audible?
Yes, Amit, you're audible. There's a bit of background noise, but
Yeah, I'm on the road, so that's why there might be a bit of background noise.
okay.
So I'll just briefly update you about this program and how support from Avni has been really helpful. So the whole activity that is being carried out is removing silt from water bodies. So there are a lot of water bodies across in Maharashtra, and we started in 2019, wherein one of the critical stakeholders was the state government. So government of Maharashtra was supporting the program, and there is one foundation, Iti Chandra Foundation, who took the lead in finding out the implementation partner, having the whole project management unit for the whole implementation and all of that. So there was a requirement that we needed an app for data recording on a regular basis and a daily basis, because desilting is an activity which happens typically from April till end of May or mid of June, when the water is not there in water bodies, and typically the farmlands are also empty. So this was a little different than what Avni was generally doing, because Avni was primarily working on the healthcare side. So we had initial discussions with Arjun. The whole concept, it was decided that this product might be very useful for this particular project. So Arjun helped us customize this particular part specifically for the desilting project. There were some critical parameters related to the machines, related to the working hours, related to the beneficiaries, and it was in a particular sequential flow. So we developed that, deployed that, and in the first year there were 2,000, approximately 2,700 water bodies desilted. 2020 there was COVID impact, because of which not much work did happen. Then 2021, this was scaled up to Karnataka and Rajasthan. So the app also, again, in addition to the English, was developed into Marathi, then Kannada, and also in Hindi. So that particular part of having the flexibility of choosing a language was something very critical for the success of the project. So that was there in the app. Then another important aspect which we included in the year two was role-based access, because there is one particular coordinator at a district level who looks into the whole district level plan for desilting, and then there are individual water body level parameters which another person records on a daily basis. So considering these things, the according to the role of the person, role-based access was created. Then we looked into the dashboards. So initially we had dashboard on the Metabase, but later on we had Jasper dashboards. So Jasper was quite easy to handle. Now also we have the dashboards on Jasper. And this year, the implementation in Rajasthan is going to be scaled up. Plus recently, couple of weeks ago, we got information that Niti Aayog is also trying to look into this particular program and trying to see how this can be implemented across India. So that way, the role of Avni overall has been really crucial in monitoring of the data and giving confidence to all the implementation agencies as well as other stakeholders that what work is happening on ground and how the impact could be seen. Because once water body is desilted and when it rains, you cannot really make out how much desilting was carried out and all of that. So the concurrent monitoring is something very critical for this particular project, and that is what we could achieve because of this particular app. There has been constant support from Arjun, Vinay, and his team. And even now we have regular calls, and we keep on trying to improvise the features. We try to see what is the feedback from ground, how can that be included in all of that. Yeah, so that's pretty much about it, Vinay.
Sure. Thanks, Amit. And one of the things that I've seen is like uh, the the implementations drive the product. So when you came in initially, the idea was we never thought about health, but when you came in, it was like, okay, it can be used in health as well. And then we started building specific features that could not have been built. So every implementation essentially comes up with things that could benefit the whole. So in that case, in that sense, like working with KPMG and with AT Chandra Foundation and everything has kind of improved the product itself. And those improvements are kind of available to every other user who's been using the system. So like I'd like to think of like Avni as like a community of different people who all kind of come together to build something that everybody could use. So at least that's the way we think about Avni.
Yeah, very true. Actually, this is very, I mean, this reflects in the conversations we have. So definitely it's a big community and I see it growing day by day.
Yeah.
Yeah.
Does anybody have questions? Actually, Amit has compressed the whole discussion into like 5 minutes. Although this, like in terms of the whole way dam desilting, like the project works, it's like there are just too many stakeholders who need to be managed. There is obviously the state governments in Maharashtra and Rajasthan, and there are these implementation like partners who would essentially come in and help with parts of these things. So I mean, and then there are these funding organizations who take like uh, who have like a different view of things. So uh, just in terms of the number of stakeholders who are there in this project, and I don't know what will happen now with Niti Aayog also coming in. So in terms of that, and that's like one dimension of the whole project, and the other dimension is in the way things get funded. Like there are obviously the typical way where NGOs or sorry donors come and fund. There's obviously state funding that's coming in, and there are parts of the cases where it's kind of crowd funded, where a lot of the work required is being, or the cost of the work required is being borne by farmers in some places. So I think slightly very similar is the IIT organization who's kind of now running a similar program in Karnataka, who's kind of running the program in Karnataka, where the model really is like, I think right now
It's the same model, Vinay. Like
yeah,
basically in 2019, when we were implementing in Maharashtra. So IIT came and they studied and all of that. So with support from AT Chandra Foundation, the pilot happened in 2021 in Karnataka. So this year they are taking it up with additional stakeholders within Karnataka itself. So it's the
right.
exactly same program being replicated and being scaled up.
Yes, yeah, agreed. So yeah, so what I was trying to bring up about is the complexity in this whole setup, and that's something that you've definitely left left out for us. But yeah, it's actually mind-boggling when I think about how everyone actually is engaged in this whole program. Questions, anybody?
Yeah, I just come in. I'm audible, right?
Yes.
Yeah, Arjun.
Sorry. Even I am traveling this time and on leave as well. First of all, thanks Amit and Pratishtha for like joining in on a short notice and sharing about the projects and updates over there. Uh, and both the projects in their own ways have been milestones for us. For example, the desilting project, like Amit you mentioned, I mean, we previously it was just health, and with dam desilting or now rejuvenating water bodies, I mean, from open chs we transitioned to Avni, and so the platform became generic. And then after that in fact many other sectors the platform, and same with where complete like a community health project was digitized, where many of the programs, so many multiple programs. Before that, it was mainly maternal and child health, but now, but NCDs and so many programs and including household, etc., was included. So made the platform more comprehensive with JSS adopting it for complete community health, and now they are expanding to various other parts of the community work that they are doing as well. And so really excited for the next steps that these projects are seeing, which is like Amit mentioned, in RWB it's looking at India level scale up, and in JSS it's uh, like animal workers reporting and monthly reporting and those kind of things. So really excited about these new parts, which are like we are going to work in this month itself on these projects. So looking forward for that. Thanks a lot.
And with that, we come to the end of the agenda. If thanks everyone for listening. If there's anybody who wants to uh, give their experience a talk, we have 4 more minutes. All right. Thanks for joining in, and see you all next month. We will send the recording of this webinar, and that will be sent pretty soon. And anybody who has joined will get the monthly newsletter next month. If you don't want to, you could unsubscribe directly from there or inform us, and you will not be included going forward. Once again, thanks everyone for listening in. Bye.
Thanks, Vinay. Thanks, Vinod, and thanks, Arjun, everyone from team.
Thank you.
you.
Pratik.